Welcome to the Explainer. High blood pressure seems pretty straightforward, doesn't it? But what if I told you that for some people, the cause has nothing to do with age or lifestyle? Today, we're going to unravel a medical mystery that completely changes how we think about this really common condition. So let's start with a puzzle. Picture this. A 30-year-old patient. They're fit, they're active, no family history of heart problems, and then, boom, they're diagnosed with severe high blood pressure. That just doesn't add up, right? This case, it doesn't fit the story we're all used to, and it's actually the key to unlocking a much deeper understanding of what's going on inside our bodies. And to really get why this puzzle is so important, just look at this number. There's some landmark data out there that shows that even if your blood pressure is totally normal at age 55, you still have about a 90% chance of developing hypertension in your lifetime. Yeah, 90%. This is not some fringe issue. It's a nearly universal health reality. That staggering risk means we really need to understand that hypertension isn't a one-size-fits-all kind of problem. So let's get back to our puzzle, the young patient with this super surprising diagnosis, and see what their story can teach all of us. Okay, so to solve our puzzle, we first have to understand the usual suspect, the type of high blood pressure that makes up the vast majority of cases. This is what's known as primary or essential hypertension. Now, it's called essential, which is kind of weird, right? It's not because it's necessary, but because doctors once thought it was just an unavoidable part of getting older. The key thing to remember here is that there's no single obvious cause. It's a condition that just kind of sneaks up on you over many years. And its development is usually a mix of things you can't change, like your genes and getting older, and things you can change, like your diet, how much you move, and alcohol intake. This is the classic profile we see in most cases of hypertension. But our 30-year-old patient, they just don't fit this mold. So when a case is this unusual, doctors start to hunt for a hidden culprit, a specific underlying medical condition that's actually causing the high blood pressure. And this, right here, this is the fundamental difference. With primary hypertension, the high blood pressure is the disease itself. But with secondary hypertension, it's just a symptom. It's a loud warning bell that something else is going on in the body. So doctors have this kind of checklist of red flags that make them think, this could be a secondary cause. We're talking about things like blood pressure that just won't come down with standard meds or comes on really suddenly. Or, like in our patient's case, you get diagnosed before you're 30 with no family history. Any one of these is a trigger to start digging deeper. Okay, now we get to the really fascinating part, the solution to our puzzle. We're about to unmask a surprisingly common cause of secondary hypertension, and it's known for having a really unique look. It's called fibromuscular dysplasia, or FMD. And let me be clear, this is not your typical artery disease. This has nothing to do with cholesterol or plaque buildup. Instead, it's a condition where the cells in the artery walls themselves just grow abnormally, causing the artery to get all narrow and tight. And the person who typically gets FMD is what makes this so interesting. It mostly affects younger women, and it loves to target the arteries that lead to the kidneys. So when those arteries get squeezed, the kidneys get tricked. They think the body's blood pressure is way too low, so they start pumping out hormones that basically scream at the body to raise the pressure, creating this dangerous feedback loop. But here's the cool part. FMD has this incredible visual clue that gives it away. On an angiogram, which is basically an X-ray for your blood vessels, doctors see this very specific pattern called the string of beads. And that's because the artery wall has these alternating rings of narrowing and bulging. It literally looks like beads on a string. And this detail is absolutely crucial for diagnosis. Atherosclerosis, the plaque buildup from cholesterol, that usually causes blockages right at the start of an artery. But FMD's string of beads happens further down. The location and the look, they tell a completely different story. So, we've seen just how complex the diagnosis can be. Now let's switch gears and talk about the action plan. Because whether the cause is primary or secondary, the goal is always the same. Get that pressure down safely to protect your vital organs. Before a doctor even thinks about writing a prescription, the official guidelines all emphasize starting with a foundation of really powerful lifestyle changes. And these aren't just suggestions, they are actually considered first-line treatment. The guidelines point to 6 key areas, and each one of these is clinically proven to lower blood pressure. We're talking about weight loss, adopting a heart-healthy diet like the DASH diet,
which by itself can drop systolic blood pressure by 11 points, slashing sodium while upping potassium, getting regular physical activity, and moderating alcohol. Every single one is a powerful tool you can use.
Now, if blood pressure stays high, even with all those efforts, that's when medication becomes necessary. And this isn't a sign of failure. It's the absolute crucial next step to protect your heart, your brain, and your kidneys from all the long-term damage that high blood pressure can cause. The main medications fall into a few big categories. You've got diuretics, which help your body flush out extra salt and water. Then there are ACE inhibitors and ARBs, which relax blood vessels by blocking a hormone system. And finally, calcium channel blockers also help relax and widen those blood vessels. Each one tackles the problem from a slightly different angle. So the big takeaway here is that treatment is definitely not one size fits all. It's a highly personal process. The ultimate goal is to work with your doctor, to become a team, and find the right combination of lifestyle changes and, if you need it, medication to get your blood pressure into a healthy range and keep it there. And to wrap this up, we'll leave you with a question that the experts themselves are still debating. Should every single patient with hypertension be screened for heart damage using an ultrasound? The very fact that this is still an open question just goes to show you that our understanding is constantly evolving as we search for better ways to treat this incredibly common yet surprisingly complex condition.